Hi, I'm Dr. Angela Yakey.
And I'm Dr. Kathleen O'Neill-Smith.
Welcome back to the FIRRIMup Doctors Good Medicine docuseries.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
All right, so now I'll go ahead and I'll introduce Dr. Angela Yakey. She's flying solo today. Dr. Kathleen couldn't make it today, but hopefully we'll see her next week. So Dr. Yakey, if you want to go ahead and take it from here.
Hi, everybody. It's so nice of you all to be with me on today's webinar. It's our 18th week together, and this is a marathon and not a sprint. So thank you all for joining me today. We're going to go through some statistics specifically for North Central Florida. Dr. Kathleen couldn't make it today. And then we're going to go through some of what I've observed as sequelae, or what's coming on the back end of having COVID-19 as we've observed. There's not a whole lot in the literature yet because it's so new. And then finally, I'm going to end with the concept of adjuvants. What is an adjuvant, and what can that do to your immune system? So I'm so glad and honored that you all could join me today. This is when we started our journey. These were in the hot spots in red of the COVID-19 infection. Not so much, right? March 5th. So mere 4 months later, look at us now. And the hot spots are very much in Florida. I know that because clinic has been absolutely crazy today. We're doing follow-up on people who've been COVID positive swabs. I saw a couple of people who are recovering from COVID now and have a chronic cough or chronic fatigue or headaches, even as far as 4 weeks later. So I do want to let you know, though, that if you're a part of our regional practice, North Florida Integrative Medicine, my regional practice in North Florida, that we do still have point of care blood spot antibody testing, both IgG and IgM. And honestly, with the latest resurgence of COVID and the slow turnaround and difficulty getting swabbed because of our current surge, we are doing what are called mass unit drive-up evaluations tomorrow afternoon. So we're busy trying to take care of you all in a very progressive, proactive way to make sure we stay safe and well. Next slide. Okay, here are the updates. So in the United States, we're almost 3.5 million confirmed positive. We've tested over 42.5 million, 130,419 deaths, over 1 million have recovered. In Florida, we've done a lot of testing. So if the US testing is 3.5 million, we've done 2.7 million tests here in Florida, 301,810 confirmed, about 20,000 hospitalized, and 4,500 deaths here in Florida. In Alachua County, we've had 2,322 confirmed positive COVID, of which 10 belong to us now. There have been 12 deaths. And in our practice here at North Florida Integrative Medicine, we've done 97 serology tests. 4 have been positives. Again, that's a past tense. They've experienced the COVID-19 infection. But actually, COVID patients that are positive are 10 now. So that number is growing. And actually, there have been 3 or 4 within the past 24 hours that have the chest pain, have the mild confusion, the congestion, the cold-like symptoms, the low-grade temperature that I've managed on telehealth that I think will end up being positive. Massachusetts, about 1 million positive, about 8,300 deaths, but they're past their peak. So we're lagging behind Dr. Kathleen's, I guess she calls it Beantown, Boston. Their peak was a couple months ago. We're now just getting into it. Yeah, so next slide. Okay, so here regionally in Alachua County, in the past week, we've had 11 new hospitalizations. We've had 2,300, we've had 5,500 negative tests and 530 positive tests. And it looks like our hospitalization rate is 4.6%. Remember in Wuhan, it was closer to 20%. But our case fatality rate is still good. It's 0.5%. 5 out of 1,000 chance that if you caught COVID that you would die from COVID. So the case fatality rate is good, but any death is too much. So that's what we're looking like in Alachua County. But again, my community hospital has closed elective surgery from today until July 27th. And that only happens when they're concerned for bed management. So what I'm going to message to the North Central Florida community, that the 6,000 patients of my regional practice, North Florida Integrated Medicine, is that if you are at high risk, these are people over 65 with more than 2 comorbid problems. Those are the chronic care management patients, of which we care for 306. Or if you're medium risk, these are middle-aged people with like heart disease or renal failure or something. Medium or high risk should shelter in for the next 2 weeks, please. Go back to the way things were back in March, when we were very strict, when we wore gloves, when we unpacked our groceries, when we didn't hang out with our grandchildren, when if you were in professions, you did telehealth only, because there's a surge. And I listened to a great webinar by a very prominent public health officer who is not on TV. But anyway, he said that, you know, what he anticipates with this virus is that we're going to have peaks and valleys all through this experience, peaks and valleys. And so at least in Alachua County, we're about to hit a peak. So if the community hospital says they're not doing elective surgery between today, July 16th, and July 27th, I'm thinking that's when our high risk and medium risk people should duck and stay sheltered in at home, go back to ordering takeout or food delivered to your house, be super careful with especially the children and the grandchildren, and act as if everybody is carrying COVID, because remember that there's a 45% asymptomatic carriage rate, meaning almost half the time you could someone could be carrying it without having any symptoms. So next slide. I actually thought, before we took the deep dive into the FAQ for this week, what is the sequelae, or what is the outcome after you recover from COVID-19? What are the potential complications is what sequelae mean. I thought, because we've been so busy managing new symptoms, new exposures, or people just feeling bad this whole week, I thought we should go back to the basics. And so I put this next slide in, because I want to spend some time going back to the basics. Okay, this was from figure 7 of our guidebook, Kick COVID-19 to the Curb, and it's still available for you on our website. But basically, you have to understand the course of the infection, especially because we've had so many accidental exposures. You need to know what you're looking for, right? Speaking of, I'll show you the 14-day monitoring guide, because it hasn't been since March and April have I referred people to the monitoring guide. We actually posted it for free on our website, FIRRIMupDoctors.com. So we'll show you that slide in a minute. But anyway, should you have any symptoms that you think might be even remotely COVID, I actually want you to get the 3 instruments out that I've been talking about since March: a good thermometer, a good blood pressure cuff, and a good pulse oximeter to monitor your oxygen. So for the longest time, back in March, it was available, pulse oximeters. Then there was a run on them. Then they were available again on Amazon. And I actually haven't heard if there's a run on them again because of Texas and Florida and the current exacerbation. Those are the 3 instruments I need to manage you on telehealth should you be sick with COVID. And so also remember that the diagnosis of COVID is not only symptoms. Honestly, if you have cold symptoms and you've lost your taste and smell and you get this weird chest pain, I don't care what the viral swab shows, this PCR, reverse transcriptase PCR test shows, or we also say real-time PCR, RT-PCR testing, which is what I'm going to go through. If you have symptoms, now that it's in North Central Florida, I'm going to treat you like it's COVID. Okay, but those are the ones that seem to be more COVID-like. So about 2 out of 3 times when you get COVID, you lose your sense of smell. It hits the olfactory nerve. We reviewed that already. and then also this weird chest pain. And I don't know if it's fascia or soft tissue pain, or is it the microscopic blood clots in the lungs that are unique to this particular virus? It's a vascular problem. So let's go back to the phases just to refresh our memory. I'm going back 2 or 3 months now because I'm having to teach this all over again. There are 4 phases to the COVID-19 infection. Phase 1 is incubation. Phase 2 is symptomatic. Phase 3 is early lung phase. Phase 4 is the late lung phase, okay? Remember that you might actually have, out of phase 1 and phase 2, very minimal symptoms like cold symptoms and feel pretty well and think you got away with it. And then what can happen is your lungs could fill up with debris, fluid, and pus, and then that's when you can't breathe. And that happens about day 10 through 14. So just today, I had a patient who said she was COVID positive, testing over 7 days ago, but she's starting to cough. So guess what? She's on the list to do one of my MASH unit visits tomorrow. And guess what? One of our healthcare professionals will be checking in on her every day, because quite honestly, this is where if the lungs start getting active with a condition called cytokine storm, or I just call it COVID lung disease, it's a third phase. And when that happens, it's like a forest fire. The little spark, you know, the match that got left on the ground and the grass started to dry wood, and it becomes this out of control cytokine storm, where essentially what's happening is the body's immune system is over exuberant, trying to get rid of or kill the virus, but you end up killing the host. Okay, that's what cytokine storm is. And so we have to be very, very careful in this time. It averages about sometime after day 10 and usually before day 14. I want that pulse oximeter monitored every single day. And if you don't have access to that, I saw, and I don't know that this is validated, but essentially a cheap way to monitor her, because even though she's been with the webinars and I told her back in March, please get a pulse oximeter, she didn't get a pulse oximeter. So a cheap way to monitor breath capacity is very easy. I will demonstrate it for you, because now that we're going to be seeing her every day on telehealth to monitor her in this critical period, I told her to monitor herself. So basically, if you take a deep breath in and on one exhalation, count to 30. If you're 30 today and tomorrow you're 25 and the next day you're 20, that's not a good thing. And if you hit 10, somewhere between 10 and 12, that's really scary. That correlates with a much lower oxygen saturation. So you can all do it with me now. It looks like there's 41 of you, and I don't know how many on Facebook Live, but let's practice, okay? So here, I'll do it with you now. So like everybody on the call, take a deep breath in. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, did you try that? If you tried it, if you didn't try it, do it now. I'll take a sip of water while you do that. If you did that and you made it to 30, you're okay. So until that patient gets a pulse oximeter, we're going to be monitoring her like that, okay? Now, you may have heard something on YouTube, because 2 of my patients forwarded me something on YouTube about inhaled corticosteroid called budesonide, the corticosteroid we use with asthma. There is a California doctor who's been using it, he says successfully early out here in the early symptomatic phase. And he says all of his patients have lived. And if so, it's because he's, through the inhaled corticosteroid, he has managed his patients to avoid the early lung phase here. Okay, so it's been so crazy in the office. I actually have asked one of my team members to pull all the Taiwanese studies. Apparently Taiwan and Japan use the protocol. And so I can review it and give you an honest assessment with Dr. Kathleen next week. But inhaled corticosteroids are actually what we use with asthma. It's what we use with asthma, okay? So Dan says the pointer's not moving. So I need some help there. Nicole, what I was saying was move the pointer to phase 2 symptomatic. So in the phase 2 symptomatic phase is when this doctor is prescribing an inhaled corticosteroid called budesonide. We use it all the time for asthma exacerbations. And I think he's doing, if the literature pans out and due diligence needs to happen, I'll have this weekend to really dig into that literature if there's anything published on it. Apparently the NIH is funding a study on inhaled budesonide through a nebulizer, which is an inhaled corticosteroid. I think what is happening, if you do it early, it's preventing phase 3. Go to phase 3, Nicole. It's preventing that phase where the lungs get full of fluid, pus, protein, and what I consider dead cells or dead soldiers. And then when that happens and the lungs get full of fluid, you feel like you're breathing against cement. That's what we're trying to prevent. I would posit to you all that if you are really healthy, you're doing everything we taught you in the immune fortification classes about stress management, excellent sleep, fortifying your immune system through 10 fruits and vegetables a day, C, zinc, and everything we taught you about, that you probably won't end up there. There was one study, I read a paper that there's a blood marker called fibrinogen that actually, if it's high, fibrinogen marks that you might end up with COVID lung disease, also known as cytokine storm. Okay, that's the cause of mortality with this infection. So let's again go back to the basics. Go back, Nicole, to phase 1, the incubation phase. This is really important. The average incubation phase is 3 to 5 days, okay? But it could be up to 21 days where you're not feeling any symptoms, and you could actually be shedding virus during this incubation phase. Phase 2 is when you become symptomatic, and the little bars at the bottom, look at the symptoms: fever, even as low as 99. Usual fever is defined as 100.4. Malaise, oh, I can't get out of bed. I'm tired. Cough, it's usually a dry cough 2 out of 3 times. 1 out of 3 times, it's a wet cough. Headache, and I've heard a lot of headache, and then diarrhea, because there are ACE2 receptors in the gut. You can present just with diarrhea about 5% of the time without anything else. So that's the symptomatic phase. We could do a viral culture in that phase, and that's when you're most contagious, but it's the most likely to be positive. The aqua on the bottom bar, on the bottom hill, is actually culturing. Nobody cultures except NIH because you need a very highly secure lab. We don't really have that. What we actually monitor is actually viral RNA, which is the army green on top. And that could be positive up to 35 days per the Wuhan trials. You actually don't know if the viral RNA is live bug or dead bug. It's just the inside of the bug. We assume it's live bug, but you don't know without culturing, but we really don't have access to culturing. Okay, so the COVID swab people tomorrow with the DUES visit, MASH unit visit people who are really sick tomorrow afternoon that we're seeing, we're actually doing COVID swab. The only difficulty is that they're so backlogged now at Quest, it's 7 business days. Okay, there is a local urgent care center who's lucky enough to have the technology to do a rapid COVID swab, but those are done inside, and he has a limit of, I think, 70 a day. So anyway, if we can help, we'd like to help. I quit doing drive-up evaluations because I thought there was enough capacity locally. If there's any questions, you could get it free at any of the outside health departments, free and easy, no problem. Alachua County is somewhat backed up. So that was a review. And then if you have any symptoms, please go to our website and either get our guidebook and share the tear off of our guidebook, which we have the paperback in the office. You could Xerox it and share it with your family and friends, or you can download this for free. It's a 14-day incubation period observational guide. Take your vital signs twice a day. It will really help us manage you. Or if you're not our patient, it'll really help your doctors manage you, because this will actually correlate with that time course I just explained. So you have across the top temperature, blood pressure, pulse, oxygen, cough, sputum, shortness of breath, vomiting, diarrhea, fatigue, aches, and other symptoms. This has been so easy to manage, especially if you have those 3 instruments I told you about: a thermometer, blood pressure cuff, and a pulse ox, which are in the second, third, the third, fourth, and fifth columns. Really easy to manage COVID positive patients on the telephone. And then I can even tell you, based on this, what I predict and at what point you have to be admitted to the hospital or go to the emergency room, of which only one of ours so far, patient number 4, and he gave us permission to talk about him discreetly, which way back in March, he, a frontline healthcare worker, presented to me with a fever to 102 on day 8 of his illness. He had self-treated. So I managed him over the weekend on telehealth. I saw him as a drive-up evaluation, did a COVID swab. It was positive, but his oxygen level was already 90. If you have a pulse oximeter, and someone actually was kind enough in the chat to say that they're still available on Amazon, the critical point is 90. If you drop below 90, you're in trouble. So it's called the oxyhemoglobin curve. Well, also, I don't like to see the trend that goes from 100 to 98 to 96 to 94 to 92 to 90 to 88. That's not a good trend. But what we find is that you're not going to go from 100 down to 90 overnight. You could go from 92 to 88 overnight. So that as soon as the trend is heading down, we're watching you like a hawk. Okay, next slide. Okay, I'm going to wrap it up with the facts, the FAQ for the week. I needed to introduce you to a concept called sequelae. And next week, when Dr. Kathleen's able to join us, we're going to spend more time on sequelae. So it's a medical term that says that it's a condition which is a consequence of a previous disease or injury. Well, let me tell you, people who survive COVID-19 infection, the virus called SARS-CoV-2, might have gotten away with not even having anything in positive antibodies. But should they have the genetic predisposition for immune confusion, it could actually trigger an autoimmune condition. So far in the literature, we actually have reported Hashimoto's autoimmune thyroid disease and a terrible condition of the nervous system called Guillain-Barré syndrome, where you have progressive paralysis as a triggering of an autoimmune condition that these people were predisposed. They caught the infection, their immune system went haywire and got confused, and then they developed autoimmune disease. So through the process of experiencing the infection, it could trigger a genetic predisposition to autoimmune disease. In the future, COVID-19 patients may experience things like pneumonia, tissue damage, and multiple organ failure. Patient number 0 actually is struggling with lung capacity after having had a combination of respiratory syncytial virus with COVID that we diagnosed in retrospect with antibodies. There is patient number, she's actually number 7, who I'm seeing tomorrow, who had COVID a month ago, who actually feels like she's having some kind of weird recurrence, but she's got baseline Crohn's disease. She's having headaches and heaviness and really never got to 100% and is now re-experiencing something that I have to figure out. So because this is a new condition, we really don't have long-term data. What I'm sharing is observational, and that's not very powerful. It's observational within my own practice, but I'm just sharing observations. We're going to be able to look back with the retrospectoscope, meaning we'll be able to analyze this in a year, but I was just sharing with you what we're finding so far. And a lot of people just feel very, very tired. Remember that it directly attacks the heart 20% of the time and causes a lot of inflammation. The other thing is that the literature, what we're finding is that diabetics, pre-diabetics metabolic syndrome, people are at very high risk for having the COVID lung condition called cytokine storm. So please, if you're diabetic, pre-diabetic, do what this awesome patient of ours did. She was pre-diabetic, a hemoglobin A1C was like 5.8. She started doing the fasting, and she lost about 30 or 40 pounds since January, and now she's probably not pre-diabetic. So her risk of complication is much lower. We actually are offering, if you're within North Florida Integrated Medicine, we're actually starting another Keto Green series today with Dr. Anna Kabaka. We also have cardiometabolic group visits every other Friday with Ashley to really help you prevent that 19-pound COVID-related weight gain from eating your stress away. We actually do believe, Dr. Kathleen and I do believe you can actually come out of this even healthier, which is the premise of our book. If you do certain things, sleep well, eat well, exercise well, keep your stress low, don't watch television, try to exercise. Next slide. I'm going to end with this, and it'll be posted on the website. This is actually from a paper in Autoimmunity Reviews in 2018 from Dr. Wattad, who is the one of the mentees of Dr. Schoenfeld from Israel, who wrote the foreword to our book. He wrote the foreword right here to kick COVID-19 to the curb. He's considered the modern father of immunology, Dr. Schoenfeld, and we're just so happy he wrote the foreword to our guidebook. That's him. Anyway, just a little food for thought, and we can develop it next week. There's a genetic predisposition to an autoimmune disease, and then you can have an environmental trigger, an environmental immune stimulatory factor, an adjuvant. An adjuvant can be anything. It could be mercury, perhaps from a immunization if you're genetically predisposed. It could be the Zika virus. I have a patient who has Zika virus-induced rheumatoid arthritis. or it could be the COVID-19 virus. Okay, so what we're saying is what the stories were so far, the case reports of autoimmunity from COVID-19, I'm telling you all that the COVID-19 will be acting as an adjuvant. So if you have a family history for autoimmune disease, you don't want to catch COVID-19. You don't want to go to the college parties where they're playing Russian roulette with who could get COVID-19 first, right? That's just craziness. You still want to try not to get it. And basically, if you're high risk or medium risk, you're holding out for a vaccine that's safe, effective and sustainable. You're holding out for treatment, and you're holding out for herd immunity. Because especially if you have a family history for genetics for autoimmune disease, you don't want to get it lest it trigger an autoimmune condition in you. And finally, the train station over here to the right can land at autoimmunity. For example, with rheumatoid arthritis, it's usually 14 years after the process starts. With systemic lupus, it could be up to 6 years. So that's what I wanted to bring out as a concept. It's a hard concept. We'll probably talk about it again with Dr. Kathleen next week about what kind of injuries we've seen. I just wanted to give you some food for thought for this week. And if you want to pull the paper, it's in Autoimmunity Reviews 2018 down below. Next slide. Okay, so I could look at the chat. Okay, let me just look at the chat. Unless Leanne, you want to, or Nicole, you want to read me some chat?
It looks like there was a couple questions that should be pretty quick answers. Someone asked, what risk level would you say someone who is a 40-year-old woman, only known comorbidity is obesity, and she was recently pregnant? What do you suggest she does as a precaution?
I would be fasting. Okay, I just read a paper that in New York City, the fasting glucose correlated with complications. So a really healthy fasting glucose is under 90. Let's say that you're obese and or you're pre-diabetic and your fasting glucose is 100, 105, 110, not diabetes. Diabetes is 126 twice fasting. But let's say you're in that higher glucose range, fast. There's nothing will hurt you. If you can fast 12 hours, 14 hours, 16 hours. And I actually love Dr. Anna Cabeco's Keto Alkaline program. It's called Keto Green 16. It's available on Amazon. It's available as an Audible book because the alkaline state is actually healthy to your immune system. And I see on the call, there have been very successful people who've done the Keto Green. And actually, of all those in the class, nobody's sick from the Keto Green class. And if you belong to us, the Keto Green series actually starts today. And you can email nfimgmv@gmail.com like now and see if you're a candidate. We're actually starting that series again actually at 4:30 to 6 p.m. It's a 3-part series over 3 weeks. So fast, eat really well, 10 fruits and vegetables a day. I would have to look at your labs to decide if you're low risk, medium, or high, but in general, you don't want that sugar high.
So that kind of touching on that, someone asked, is aggressive weight loss still a good idea during the peak?
Aggressive exercise and aggressive weight loss is not a great idea because if you do aggressive weight loss, it's going to stress your body. So gentle weight loss is like a pound a week is gentle. A pound a week is very gentle. But if you're talking 12 pounds a month, that's actually too fast. You don't like our D1 athletes, our competitors. I said, chill out right now. You need your energy to beat COVID should you get infected.
All right. And I think that's about all we have time for today. Unless anyone else.
Thank you all for coming. I will move over to Facebook in a few minutes. I'm going to wrap some stuff up at my office. And yeah, so be safe, be well, and God bless you all. Thank you, Nicole and Leanne, for helping me.
Yep, I'm going to wrap us up here and go over a couple of our specials that we currently have going on and some supplements to help fortify you guys' immune systems. So currently we have this deal going on, 10% off of the Nordic Naturals Pro Omega supplements. You can use this code FIRRIMup Omega. You can get it through the FIRRIMup Get Healthy store, which we can link on our Facebook page. It's through our FIRRIMup Doctors website where you can just go shop on the tab bar and then get healthy and it'll bring you to our storefront. This is the other option for vegans. It's called Algae Omega. So it's another omega supplement and you can use FIRRIM Algae for 10% off. And this is only good until tomorrow. So if you want to get it, don't miss out. You only have until tomorrow. In office, we're currently selling these med packs, which are called the Basic Immune Pack, and we sell them for $20, which is a really great deal. We have zinc, which is 20 milligrams in them, D3 2000, and immunoglobulins, and you just take all 3 of them in the morning. But we also want to, Dr. Hughes suggested, don't forget about your vitamin C. She suggests 4,000 milligrams if you can tolerate it, but at least 2,000 milligrams to help fortify your immune system. And here at North Florida Integrative Medicine, which is in Gainesville, Florida, we're still offering point of care blood spot antibody testing on Fridays. It'll tell you if you're still in the middle of the virus or if you've developed the antibodies and you're through it. If you're interested in that, you can email nfimgmv@gmail.com and we can get you scheduled and figure out what time is best for you. And then last thing, we're still selling our guidebook, which can be bought on FIRRIMupDoctors.com. We have an ebook available for $9.99, and you'll see that on the website. And we currently have this July special going on. If you purchase the guidebook, the paperback, or the ebook, you'll get 20% off of the ultra potent vitamin C, which is very important, and the zinc AG 20 milligrams. You have to be a patient to get this deal. So if you want to become a new patient of ours and you're local here in Gainesville, you can email nfimgmv@gmail.com. And that is all we have for today. Thank you all for sticking with us through this pandemic. We'll see you guys next Thursday. If anyone has any other questions, you can meet us over on Facebook and you can chat on the Facebook page or on the actual live video, and we'll be able to answer that for you. Thank you all.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMupDoctors.com. That's FIRRIM updoctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out.
The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.